Dr. Dickson, the CEO of UMass Memorial Healthcare. They say that necessity is the mother of invention and innovation. And right now during this crisis, we have had to innovate quite a bit to try to get the protective equipment that we need to keep our patients and our people safe. One of the challenges we've had is the standard face shields that we use when dealing with a patient with infection, especially during procedures like intubation. We've just run out of them. And so our people have had to make several different models to try to cope with this. This came from Nicole Pustis up in pediatrics. It's pretty simple. It's a laminated sheet with a piece of foam. This is a phlebotomy arm band that she's now used for the back. And you put that on and voila, you get a face shield. The only problem with it is it's a little bit too close to your face and it starts to fog up over time, so you can't wear it for very long periods of time. My friend Neil McDonough over at FlexCom made these for us. Really appreciate his work. This goes right in with a set of standard glasses and covers you here. It gives you that little bit of distance and prevents the fogging. But looking plastic through plastic has been difficult. So that's not ideal, but it's better than nothing. And then the last one is the most impressive but hardest to get. This is a 3D printed face shield mold that just takes a 3-punch laminate here and gives you that separation that you need to keep you from fogging up, but the protection also. This will rip right off and you can put a new shield on if you think that it's been contaminated, or you can wash that shield. Right now, we need our innovators and our inventors doing everything they can to help us solve the problems that we're facing as we fight this war against COVID-19. So if any of you have any great ideas about how you can get us some face shields, especially those with a little gap from the head to prevent fogging, and any anti-fog filament that we could put here, we'd really appreciate your help. Thanks. I should have just done that.